What's going on, everyone? This is Derek with Orthopedic Physical Therapy Products, and I'm really excited to bring you this next level content education series episode in collaboration with EIM Evidence in Motion. Today, we're going to be talking to Paul Mintken, who sort of specializes in musculoskeletal and orthopedic manual physical therapy. He's got a lot of great information to highlight for us today. And again, this education series is all about helping you, the clinician, learn and sort of understand how specializing or obtaining some education in this area can help you improve patient outcomes and upskill at the same time. So Paul, thanks so much for joining us today.
Oh, thanks, Derek. Excited to be here.
Awesome. Well, let's get started with a little bit of storytelling here. I always find that people are kind of most interested in stories about how this education has helped a patient in your life. I'm sure you've got a lot of profound stories, but what's something you can share with us where this education helped you specifically really improve the outcome for a patient?
Yeah, that's a great question. And there are, many stories, helping people walk again and get back to what they want to be doing is always very rewarding. But, I think where this training, helped me out, one of the best stories is determining that the patient that was seeing me did not have a musculoskeletal problem. And that's valuable too, to be able to screen the individual. So this was somebody who went to undergraduate university in New York City and had just severe dizziness, and she suffered with it. She didn't have health insurance for 3 years, and she had to walk down the street holding on to walls and surfing from, benches to light poles and things like that. She rode the bus everywhere. She could not drive. And she came to the University of Colorado, where I work as a clinician, and was referred in to see me for dizziness. And the thinking was maybe it was something coming from her neck, some cervicogenic dizziness. But through my screening and my knowledge of screening as well as musculoskeletal problems, I determined that it was not cervicogenic dizziness, but more BPPV, which is benign paroxysmal positional vertigo, which is very simple to treat. And within 2 sessions, the dizziness had resolved completely, and she was just amazed that she could walk down the street without having to surf from one item to the next. So it just made a profound difference in her life. And she brought me cookies during the holidays for the next couple of years while she was in school there. But the value of the education is knowing what's a musculoskeletal problem and maybe what's not, and what the best treatment for that patient might be.
Sure. Yeah. So what led you then, or inspired you to make this, musculoskeletal / orthopedic manual PT, a specialization that you wanted to have? What inspired you to get into it?
Well, that's kind of an interesting story. I originally got into PT because I'm a recovering rugby player, and I had several knee injuries that required surgery, which forced me to go to PT, and I really enjoyed it. I was kind of on the track to go to medical school at that time, but I thought, physical therapy would be a great career overall. And so in PT school, I really fell in love with the neurological system and started to really think I wanted to work with patients who had spinal cord injury. So I did my last clinical rotation in physical therapy school at Craig Hospital, which specializes in treating patients with spinal cord injury. And I really loved the work, but it hit a little too close to home because I was treating all these patients who were catastrophically injured doing things that I love to do, playing rugby, riding motocross bikes, cliff diving, doing all the stuff that, young individuals do overall. And I could not leave my feelings and emotions at work. And it really took a psychological toll on me. And I realized at that time that I wasn't really emotionally equipped to do that work. So I dove into outpatient orthopedics and musculoskeletal and haven't really looked back from that point. So
very cool. Okay, so you now, correct me if I'm wrong, but you sort of oversee the musculoskeletal and orthopedics categories for EIM, or are you just kind of you're at faculty, obviously. What is your direct role then with EIM, first of all?
My direct role is I'm just basically a consultant. So I help with the musculoskeletal content from like the 20,000 foot view. Are we delivering kind of the model and the approach that reflects current best evidence overall? So I'm not involved in a lot of the minutia and things like that. Just more making sure we're doing the right thing as based on current best evidence and that kind of thing. My main gig is I'm a professor at Hawaii Pacific University, which is an EIM university partner. They just opened a new hybrid physical therapy program there. So I teach through them, which is integrally connected with evidence in motion. And I've been teaching with them since I got into academia almost 20 years ago or so. I met John Childs and Tim Flynn and Rob Weiner, who really were mentors who sparked my career and helped me out so much. So I've stuck around the company ever since.
That's great. So as someone then who kind of has the 30,000 foot view of a lot of what's going on in these categories, can you describe to us what it's like to take a course in musculoskeletal health or orthopedic manual PT through EIM?
Yeah, so we really try to incorporate the current best evidence. I mean, the name of the company, Evidence in Motion, I've loved since the beginning, because really it is all about translating current best evidence into skills that you can take into the clinic to treat your patient on Monday morning. And we really do take a biopsychosocial approach, treating the human being that's in front of you, knowing that they may be seeing you for a musculoskeletal problem, but there's so many other variables that go into a successful outcome with that condition. So we really try to teach that overarching 20,000 foot view, that how the patient sleeps and what they eat, and do they have anxiety, do they have depression, do they have other things that are contributing to their current problem that they're seeing you for. And we try to teach the individuals to manage, holistically, the individual.
Very cool. So then I guess to build off of that, you've obtained these skills, you've overseen what EIM is doing in these subject matters. How has this education and all the knowledge you've obtained here help you take, your career to the next level? And then how do you think it can also help someone watching, a physical therapist or a student right now who's kind of deciding if and what they would like to specialize in? Can you kind of explain those two kind of aspects to us, how it's helped you and then how it could help someone else?
Yeah, it's really helped me kind of approach a patient with a deep understanding of how complex the musculoskeletal system and the individual human being that's sitting in front of me. So, the approach that we use really is deeply seated in that biopsychosocial model that tells us you can't really separate the mind from the body. So if the mind is not healthy, the body will suffer, and vice versa. So we really teach our students not to look only at the musculoskeletal system, but the individual as a whole. And we just had a paper published in Physical Therapy Journal on a standardized definition of what orthopedic manual physical therapy is. And it really details that it's a systematic and active patient-centered approach. A lot of people think, evidence in motion, it's manual therapy, it's manipulation, because that's where a lot of the evidence started, but it really is incorporating the current best evidence, which shows us that multimodal intervention using some hands-on treatment as well as exercise and patient education leads to the ultimate best outcome for your patients.
So in a course, say the post-professional DPT course, musculoskeletal management, what are some of the manual aspects learned in that? And then maybe some of the more lifestyle aspects of that as well, just to get a feel for the spectrum, learning that we're talking about here.
Yeah, so first off, we go through kind of screening, and that includes not only screening for red flags, potential things that, may indicate that the patient sitting in front of you is not a candidate for PT today, and also screening for the psychosocial things that we've been talking about, anxiety, depression, fear avoidance, those type of things. So we start off, doing a good history with our patients, doing some good screening, making sure that that patient belongs in our clinic, or maybe they need some additional help. Maybe they're good candidates for PT at this time, but you need some more medical information, or you think that the patient might benefit from seeing a mental health provider or something like that. Then we get into doing the actual examination. We really teach kind of a test-retest approach, which is very Maitland-based, but coming up with what we call asterisk signs. So movements or postures or activities that the patient can do that consistently reproduces their symptoms. And we use that as a baseline, but also as a reassessment. And then we apply current best evidence, teach the students how to do manual therapy interventions, stretches, exercises, other things from the current best evidence that might change, that asterisk sign, and that gets immediate buy-in from the patient. Let's say they're having difficulty looking over their shoulder while they're driving because they have some neck pain. You do an intervention and all of a sudden they can do that without pain. That immediately gets buy-in from the patient. So sometimes it is using a manual therapy technique, but sometimes it's doing an exercise or a stretch or simply patient education. We've had profound improvements with that. So we kind of systematically go through doing a good history, making sure the patient belongs in your clinic today, doing a good physical examination, and then using that asterisk sign to kind of drive our treatment, whether that's hands-on exercise or patient education.
Oh, very nice. It sounds very comprehensive. Yeah, pretty clear to understand the value in that and how it can help a clinician sort of take their level of knowledge and quality of care to the next level. It's great. Okay, one last question for you here before we sign off, and this one is for all the up and coming PTs, OTs, other clinicians out there. And this doesn't even have to be related specifically to these subjects that we're talking about here, but what's one key piece of advice you can give someone who's up and coming into in their career path and into PT or OT or any other kind of clinical category?
Yeah, one key piece of advice I'd give to a new PT or someone interested in becoming a PT is to embrace the importance of lifelong learning and adaptability. I don't know it all. I'm learning new things all the time. The more I learn, the less I know. So staying humble, realizing that you can't know it all, but just trying to do your best to stay up on that. And then the other piece of advice I'd give a new PT is to learn to take care of themselves. In our training, we teach you how to take care of others, but we don't do a great job of teaching you how to take care of yourself. And you need to treat yourself like you'd treat your patients. And we just completed a study that showed 50% of PTs are burned out. So you're no good to your patients if you're struggling. So you really need to practice what you preach and practice what you learn in your education. What's good for your patients is good for you too. And we forget that.
Great pieces of advice, Paul. Awesome. Well, really appreciate your insights and knowledge and time today. I think your words of wisdom are going to help a lot of people here, which is great. Any parting words before we sign off here?
No, I guess the main thing would be that I'm passionate about evidence in motion. It really changed my life. The founders, John Childs and Tim Flynn and Rob Weiner, when I was a new teacher in academia, I'd been a clinician for 10 years, and I reached out to them and said, "Help! I'm teaching, in an academic level, what's entry-level PT?" And they shared all of their knowledge with me, gave me all their content and said, "Here, this is what I teach," which is pretty rare. So this company has a foundation in paying it forward, sharing the knowledge, not siloing knowledge and that type of thing. So I'm really passionate about the mission, vision, and values of this company.
Yeah, it's interesting also how I've just experienced through all the faculty members I've interviewed, how that those qualities, those traits or personality aspects or whatever, have sort of trickled down into everybody. Everyone's so authentic and genuine and passionate about what they do, and I really appreciate that as well. So anyway, yeah, thank you so much for your time, Paul. I'll also just plug OPTP real quick for those of you watching who aren't familiar with OPTP. We distribute and manufacture some of the highest quality PT, fitness, Pilates, rehabilitation tools. So definitely check out OPTP as well. But we hope you all learned a lot during this interview. Make sure you stay tuned for our next level interview in collaboration with EIM as well. But until then, we're going to sign off. Paul, thanks again so much. We'll talk to everyone next time.